what is HPV and what are viruses?
Viruses are very small particles, much smaller than germs, who can cause inflammations and changing of the cells and tissues in the body. And HPV is human papilloma virus. That is a virus that you get mostly by making love or sex, and it's very contagious. So even if you do use condoms, still with your hands you can give it to the other partner, the person you're making love with. So it's so contagious. The point is, here in Holland, we say that 80% of all sexual active people will get HPV.
80%?
80% of the sexual active persons.
You said it is contagious.
Very contagious.
Even when you use condom?
Well, when you use it very carefully, 100% condoms, you will have protection. But normally spoken, if you just get it one time, the protection is over.
Why do you say 80% would get it, doctor?
Well, that shows the investigation, the figures of it, that 80% will get it just by making love the normal way. And but you must think that, or you must know, that your immune system is capable of attack the virus and let it go away. Only a few percentage, a low percentage of the women who can't get rid of the HPV can develop cervix cancer, because that's the main problem. The changing of cells of the cervix by the virus gives changing in the pap smear result. You take some cells of the cervix and the laboratory look at it, and you can say it's completely normal, or it's already changing a little bit or more, and at last, in about 10 or 12 years, if your immune system can't take care of it, you can develop cervix cancer.
So what causes cancer of the cervix?
HPV.
Wow.
So the last few years, it's known that the cervix cancer is caused by HPV.
HPV. And how long does it take for cervical cancer to develop?
When you have your HPV and your immune system is not strong enough, it will take 10, 12 or 15 years, and then you can develop cervix cancer. So it takes several years, and those years you must take care that you have your controls, your pap smear, or your HPV culture, and then you can take measurements to prevent it.
So, just like you said, about 80% of sexually active people can get this.
Right.
So, does that mean people can get this? People can get cervical cancer, not even knowing that they have it?
That's right. Yes. But on the other hand, it's only a few. It's a low percentage that will develop cancer because your immune system is normally strong enough.
Okay.
But yes, everybody can get it who can get HPV, and it will be 80% who can get it.
So can one prevent cervical cancer? Or can cervical cancer be prevented?
Non-spoken, yes. There are a few possibilities. At this moment, the main thing is that there can be vaccination. Vaccination. As you must know, there are more than 100 types of HPV.
Yes.
More than 100. And they're just numbered 1, 2, 3, and so on and so forth. And there are about 50 or maybe a little bit more who can develop cervix cancer. And 16 and 18, are the main ones who can cause it. There are 13 others, 31, 33, and so on and so forth, who can do it, but are less aggressive than 16 and 18.
So, Dr. Oey, this HPV, is it only women that get it?
No.
Do men also get HPV?
Definitely. both can get it. And that's the reason that the man can give further to his partner. So it's for man to woman and woman to man.
So also this HPV is discharge of genital wax or what?
It's also genital wax, but it's different numbers. It is number 6 and number 11 gives genital wax. On the other hand, genital wax are never malignant. And it also, the vaccination of 16 and 18 also prevents the possible cancer of the vagina.
Yes.
And the vulva, the lips and things like that.
What can you do to protect yourself from getting HPV? Because this ratio you made mention of is alarming.
It's difficult to prevent of getting it because it's so widespread. So the condoms will help if you are very careful with it. But even then, it's not completely sure that you can prevent it. So what the government just offers you is a vaccination against 16 and 18. And not for the others who are, we call it high risk HPV.
Yeah.
Positive. Not for the other high risk, but they are less aggressive. So by the routine controls, you can find it and then do a small treatment. That means take a small part at the beginning of the cervix away, and then you take away the HPV, and then your immune system is capable of getting rid of the rest of the HPV.
Wow.
It is long before you have developed cervix cancer.
Okay. Wow. So, what are the benefits of this vaccine? The vaccine you came to talk about
That's
today.
right. Yeah. The vaccine is against 16 and 18 because they are the most important ones who develop cervix cancer and are the most widespread. Because 16 and 18 is responsible for about 70% of the infections with HPV, and the other ones for 30%. So that's the reason why they got an infection 16 and 18, and because 16 and 18 are the most aggressive of the high-risk HPVs. There are two vaccines at the moment in Holland. That is, I'm not making a reclame or something, but it's Gardasil, a company that is 6, 11, 16 and 18 in it, and there is Cervix for 16 and 18 in it. And the government offers it to young girls. Normally they like to give it before they have had sex, before they have the chance to have already HPV. So they start with girls for 12 years and in schools. And it's bad luck, but in Amsterdam, for example, only about 50 to 53% of the girls who could get it has given herself in for the vaccination.
But why?
They're just afraid. They don't know. There are horror stories in the world. When you get from the vaccination, you get infertility.
Oh!
That's what they say. It's definitely not true, but that's what made them afraid for it.
Oh, okay.
Because, but it's so nice because the vaccine is made not of the virus,
yeah,
but of the outside of the virus, where no virus is in it. And the body recognizes it as virus. So the body makes antibodies against the virus, although there's no living virus in the vaccine.
Yeah.
So this is a harmless vaccine, as far as we know, yet, because there's no living virus in it. There's nothing that can cause damage. There's one thing, only if you use it for a very long time, you know, for many years, if on long term it's no harm. But now we stop it,
Yeah.
as far as we know, it's harmless. It definitely is harmless.
So where did they get the fear then that they will become infertile?
That's always so difficult. Why come stories into the world.
Yeah, but what are you people doing to prevent this stories?
Yes.
This is very important.
Well, there is a group of people who are against vaccine, and it's a strong group, and they bring stories into the world that it's dangerous. They also don't want other vaccines, not for the German measles, not for pox, for nothing. They want the vaccine, and also not for HPV. And this is a widespread misunderstanding of the good things of the vaccine.
Really?
Definitely, yeah.
And there's no way to convince people that this vaccine is very necessary, even when it's very crucial that people must have them.
Yes, but it's always easier to make people afraid of something than being sure of them. Sure, yeah.
So, Dr. Oey, why is this vaccine limited to certain number of, certain ages of women, and not for all ages? Why?
Yeah, the vaccine can be used for elderly women also. We say at the moment until 45. But the government only offers it when they are young, so there's the big chance they don't have sex yet. So the effect of the vaccine will be maximum. The cost of the vaccine, 3 injections, after a year, and it is €375 for the 3 injections.
Okay.
And that's, for a lot of people, it's really too much.
Yeah.
So it's a good idea to start with young girls, 12 years, so that in the coming years, in about 20 years, if everybody would have taken it, the chance on the HPV infection causing cervical cancer will be very, very low. But if only 50% will do it, the effect is very, very little in the long run.
So this vaccine, if it's taken, is it annually you have to repeat it, or is it just one time?
3 injections within a year. Non-spoken is...
So that means every year?
No, just once. 1 year. 3 injections and that's it.
For life?
For life.
Wow. I think it's so the insurance companies, are they supposed to pay for it? The health insurance companies?
They won't pay for it. It's just that the government has given the opportunity for the young girls to do it. And at this moment they still make it longer for up to girls up to 16 years to get the injection. After 16 years you have to pay for it yourself. And it's very nice because if you do the investigation which age is mostly capable for getting HPV, then you find the top of it between 18 and 26, and again about 40, 45, because the first group is when they become sexual active, and the second group is when they have a second chance and have new partners and start all over again. But the second group has to pay themselves.
Do you need to be tested for HPV before getting the vaccine?
No, you don't do it, because the vaccine is against 16 and 18. The chance that you have both of them is just 1%. You have or 16 or 18 or one of the others. So if you get the vaccination, you still take the other one. So if you have 18, you vaccinate against 16 and the other way around. What we like to do here is that we control people as routine screening for HPV screening. That would be definitely a better choice. At this moment it's still the surface smear, pump smear that we do. But I think that in the future the government will change and go to the HPV because the reliability will be better with the HPV culture instead of the pump smear.
So what is the difference between the pap smear and the HPV? We will discuss that in our next lesson.
Okay.
All right.